Have you ever wondered if the medications sitting in your medicine cabinet could be secretly affecting your heart? Today, we're diving deep into a crucial topic that doesn't get enough attention: common medications that can weaken heart muscles, spike blood pressure, and trigger dangerous irregular heart rhythms. I'm not here to scare you or tell you to throw away your medications. Instead, this is about empowerment through education. Understanding these risks helps you have informed conversations with your healthcare providers and make better decisions about your health. Before we begin, remember this golden rule: never stop taking prescribed medications without consulting your doctor first. Abruptly stopping certain medications can be more dangerous than the risks we're discussing today. This information is meant to educate, not replace professional medical advice. Pill number 1: NSAIDs, the hidden danger in your pain relief. Let's start with something probably sitting in your medicine cabinet right now: NSAIDs, or non-steroidal anti-inflammatory drugs. These include over-the-counter favorites like ibuprofen, Advil, Motrin, naproxen, Aleve, and prescription varieties like Selexib, Celebrex. How they affect your heart. NSAIDs work by blocking enzymes called COX-1 and COX-2, which reduce inflammation and pain. But here's what the commercials don't tell you: these same enzymes play crucial roles in protecting your cardiovascular system. When you regularly take NSAIDs, especially at high doses, 3 concerning things happen to your heart. First, they cause your body to retain sodium and water. Imagine your blood vessels as garden hoses. When you add more water without increasing the hose size, pressure builds up. This fluid retention can increase blood pressure by 5 to 10 millimeters of mercury in some people, which might not sound like much, but for someone already managing hypertension, it's significant. Second, NSAIDs can reduce the effectiveness of blood pressure medications. If you're taking ACE inhibitors, beta blockers, or diuretics for your heart, NSAIDs can essentially cancel out their benefits. It's like pressing the gas and brake pedals simultaneously. Third, and most concerning, studies have shown that regular NSAID use can increase the risk of heart attack and stroke by 20 to 50%, with the risk appearing as early as the first week of use and increasing with longer duration and higher doses. Real-world impact. A 2017 study published in the British Medical Journal analyzed over 440,000 people and found that taking any dose of NSAIDs for 1 week, 1 month, or more than a month was associated with an increased risk of heart attack. The risk was greatest with higher doses. What you can do. If you need pain relief, consider acetaminophen, Tylenol, first, though it has its own risks at high doses. For chronic pain, explore non-drug options like physical therapy, acupuncture, or cognitive behavioral therapy. If you must use NSAIDs, use the lowest effective dose for the shortest time possible, and always inform your doctor if you have heart disease or risk factors. Pill number 2: decongestants, when clearing your nose clogs your arteries. During cold and flu season, decongestants like pseudoephedrine, Sudift, and phenylephrine seem like lifesavers. But these common medications can create serious problems for your cardiovascular system. The mechanism of harm. Decongestants work by constricting blood vessels in your nasal passages, reducing swelling and congestion. The problem? They don't just constrict nasal blood vessels, they affect blood vessels throughout your entire body. When blood vessels constrict systemically, your heart has to work harder to pump blood through these narrowed passages. It's like trying to push the same amount of water through a straw instead of a garden hose. This can cause blood pressure to spike by 10 to 15 millimeters of mercury or more, particularly dangerous for people with existing hypertension. Effects on heart rhythm. Beyond blood pressure, decongestants can trigger arrhythmias, irregular heartbeats. They stimulate the sympathetic nervous system, essentially putting your body in a mild fight or flight state. Your heart rate increases, and in susceptible individuals, this can trigger conditions like atrial fibrillation or premature ventricular contractions. The hidden sources. Here's what makes decongestants particularly tricky: they're hidden in many combination cold and flu medications. That all-in-one cold medicine might contain a decongestant you didn't even know you were taking. Products labeled D, like Claritin D or Mucinex D, contain decongestants. Special populations at risk. People with coronary artery disease, heart failure, uncontrolled high blood pressure, or thyroid disorders should be especially cautious. Even healthy individuals taking MAO inhibitors for depression should avoid decongestants entirely, as the combination can cause dangerous blood pressure spikes. Safer alternatives. Try saline nasal rinses, steam inhalation, or nasal strips for congestion. If you must use a decongestant, opt for nasal sprays over oral medications. They have less systemic absorption. Limit use to 3 days to avoid rebound congestion, and always check your blood pressure if you have cardiovascular concerns. Pill number 3, antidepressants, the mood-heart connection. Depression and heart disease often go hand in hand, making antidepressant use common in cardiac patients. However, certain antidepressants can themselves pose cardiovascular risks. Tricyclic antidepressants, TCAs. Older antidepressants like amitriptyline, nortriptyline, and imipramine are the most concerning for heart health. TCAs affect the heart's electrical conduction system, potentially causing QT prolongation. This shows up on an EKG as an extended time between heartbeats, increasing the risk of a potentially fatal arrhythmia called torsades de pointes orthostatic hypertension, a sudden drop in blood pressure when standing, leading to dizziness and falls, increased heart rate and decreased heart rate variability, both markers of cardiovascular stress. SNRIs and blood pressure. Newer antidepressants like venlafaxine, Effexor, and duloxetine, Cymbalta, can increase blood pressure, particularly at higher doses. Venlafaxine can raise blood pressure by 5 to 15 millimeters of mercury in some patients, with the effect being dose-dependent. The serotonin factor. Even SSRIs, generally considered heart-safe, can affect platelet function and blood clotting. While this might reduce heart attack risk in some people, it can increase bleeding risk, especially when combined with blood thinners. The withdrawal risk. Abruptly stopping antidepressants can trigger withdrawal symptoms that stress the cardiovascular system, including rapid heart rate, blood pressure fluctuations, and electric shock sensations. Some studies suggest that antidepressant discontinuation syndrome can trigger cardiac events in vulnerable individuals. Balancing mental and heart health. Depression itself is a major cardiovascular risk factor, so treating it is crucial. The key is choosing the right medication. SSRIs like sertraline are often preferred for cardiac patients. Regular monitoring of blood pressure and EKGs may be necessary, especially when starting or adjusting doses. Pill number 4, diabetes medications, when blood sugar control backfires. Managing diabetes is crucial for heart health, but ironically, some diabetes medications can create their own cardiovascular problems. Thiazolidinedians, TZDs. Medications like rosiglitazone, Avandia, and pioglitazone, Actos, improve insulin sensitivity but can cause significant fluid retention. This isn't just minor swelling. TZDs can increase plasma volume by 6 to 7%, potentially triggering or worsening heart failure. The mechanism involves increased sodium reabsorption in the kidneys and enhanced vascular permeability. For patients with existing heart failure, TZDs can double the risk of hospitalization. Even in patients without known heart disease, these drugs can unmask hidden cardiac dysfunction. Sulfonylureas and cardiac events. Older diabetes drugs like glyburide and glipizide work by forcing the pancreas to produce more insulin. However, they also affect potassium channels in heart muscle, potentially impairing the heart's ability to protect itself during a heart attack, eliminating ischemic preconditioning, increasing the risk of dangerous arrhythmias, contributing to higher cardiovascular death rates compared to newer diabetes medications. The hypoglycemia heart risk. Several diabetes medications can cause low blood sugar, which triggers a stress response, rapid heartbeat, increased blood pressure, and heightened clotting risk. Severe hypoglycemia can trigger heart attacks, strokes, and dangerous arrhythmias, particularly in older adults or those with existing heart disease. SGLT2 inhibitors, a mixed bag. Newer drugs like empagliflozin, Jardiance, actually protect the heart in many ways, but they can cause dehydration and electrolyte imbalances that affect heart rhythm. Early in treatment, they may cause a temporary increase in heart rate. The better options. Metformin remains the first-line choice for most patients, with cardiovascular benefits. Newer GLP-1 agonists like semaglutide actually reduce cardiovascular risk. The key is individualizing therapy based on cardiac risk factors and regular monitoring. Pill number 5. Stimulant ADHD medications, speed for the brain, stress for the heart. Medications like methylphenidate, Ritalin, Concerta, and amphetamines, Adderall, Vyvanse, help millions focus better, but they are essentially controlled cardiovascular stimulants. The cardiovascular storm. Stimulants activate the sympathetic nervous system, causing increased heart rate by the 5th of October beats per minute on average blood pressure elevation of 2 to 6 millimeters of mercury typically, but up to 15 to 20 millimeters of mercury in some individuals, increased cardiac workload and oxygen demand potential for arrhythmias, particularly at higher doses. The mechanism. These medications increase norepinephrine and dopamine in the brain, but these neurotransmitters also affect the heart and blood vessels. It's like having a constant, mild adrenaline rush, helpful for focus, potentially harmful for the heart. Long-term concerns. While short-term use in healthy individuals is generally safe, long-term stimulant use may accelerate atherosclerosis, plaque buildup in arteries, increase left ventricular mass, thickening of the heart muscle, potentially increase stroke risk, particularly in adults over 40. The sudden death controversy. While rare, sudden cardiac death has been reported with stimulant use, particularly in people with underlying heart conditions. Pre-existing conditions like hypertrophic cardiomyopathy, coronary artery anomalies, or long QT syndrome significantly increase risk. Special considerations. Adults starting ADHD medications later in life need careful cardiac screening, as they are more likely to have underlying cardiovascular disease. Combining stimulants with other medications, like decongestants or certain antidepressants, can compound cardiovascular effects. Risk mitigation. Before starting stimulants, get a thorough cardiac history and physical exam. An EKG may be warranted for adults or those with risk factors. Regular blood pressure monitoring is essential. Non-stimulant ADHD medications like atomoxetine or guanfacine may be safer alternatives for those with cardiac concerns. Pill number 6. Anticholinergic medications, the dry mouth, racing heart connection. Anticholinergics include medications for allergies, diphenhydramine, Benadryl, overactive bladder, oxybutynin, ditropan, and some antidepressants. They block acetylcholine, a neurotransmitter that normally slows heart rate. Cardiovascular effects. By blocking acetylcholine's calming effect on the heart, anticholinergics cause increased heart rate, tachycardia, sometimes by 20 to 30 beats per minute, reduced heart rate variability, a marker of cardiovascular health, potential for triggering atrial fibrillation in susceptible individuals, impaired temperature regulation, increasing heat stroke risk. The cognitive cardiac connection. Recent research shows chronic anticholinergic use is linked to cognitive decline and dementia. The same mechanism that affects the brain also impacts the heart's autonomic nervous system, potentially accelerating cardiovascular aging. Hidden sources. Many people don't realize they are taking anticholinergics. They're in over-the-counter sleep aids, most contain diphenhydramine, motion sickness medications, dimenhydrinate, Dramamine, some stomach medications, dicyclamine, Bentyl, certain muscle relaxants, cyclobenzaprine, Flexeril. The cumulative burden. The anticholinergic burden increases when multiple medications with these properties are combined. An older adult taking Benadryl for allergies, oxybutynin for bladder issues, and amitriptyline for pain has a triple anticholinergic burden, significantly increasing cardiovascular risk. Vulnerable populations. Elderly individuals are particularly susceptible due to decreased acetylcholine production with aging, higher likelihood of polypharmacy, reduced ability to metabolize these drugs, greater sensitivity to autonomic effects. Alternatives. For allergies, try newer antihistamines like cetirizine or loratadine. For overactive bladder, consider newer medications like mirabegron. For sleep, try melatonin or cognitive behavioral therapy for insomnia instead of anticholinergic sleep aids. Pill number 7. Chemotherapy drugs, when cancer treatment hurts the heart. Cancer treatment saves lives, but certain chemotherapy drugs can cause lasting heart damage, a field now called cardio-oncology. Anthracyclines, the double-edged sword. Drugs like doxorubicin, adriamycin, and daunorubicin are highly effective against cancer but toxic to heart muscle cells. They cause direct cardiomyocyte, heart muscle cell, death, oxidative stress, and mitochondrial dysfunction, progressive weakening leading to heart failure, sometimes years after treatment. Dose-dependent damage. The more you receive, the higher the risk. The statistics. About 10% of patients receiving anthracyclines develop heart failure within 10 years. The risk increases to 30% or more at higher cumulative doses. Children who receive these drugs face lifelong cardiac monitoring. Targeted therapies. Newer targeted cancer drugs can also affect the heart. Trastuzumab, Herceptin, for breast cancer can cause reversible heart dysfunction in 10 to 15% of patients. Tyrosine kinase inhibitors like sunitinib can cause hypertension and heart failure. Immune checkpoint inhibitors can rarely cause myocarditis, heart inflammation. 5-fluorouracil and coronary spasm. This common chemotherapy drug can cause coronary artery spasm, leading to chest pain and even heart attacks during infusion. The incidence ranges from 1 to 18%, with symptoms typically occurring during or shortly after treatment. Radiation synergy. When chemotherapy is combined with chest radiation, cardiac risks multiply. Radiation can damage coronary arteries, heart valves, and the pericardium, effects that may not manifest for decades. Protective strategies. Cardio-oncology programs now monitor heart function before, during, and after cancer treatment. Protective strategies include using dexrazoxane to protect against anthracycline toxicity, baseline and serial echocardiograms, or cardiac MI, prophylactic AC inhibitors or beta blockers in high-risk patients, dose modification or alternative drugs when possible, integration and risk management. 2 minutes. Now that we've covered these 7 categories, let's talk about real-world risk management. Most people taking these medications won't experience severe cardiac problems, but understanding risk factors helps you stay safe. Cumulative risk factors. Your cardiovascular risk from medications increases with age, over 65, pre-existing heart disease or hypertension, diabetes or kidney disease, obesity, smoking, family history of heart disease, taking multiple medications, polypharmacy. The multiplication effect. Risks don't just add up, they multiply. Taking an NSAID while on an ADHD stimulant and using a decongestant for a cold creates a potentially dangerous combination. Each medication alone might raise blood pressure by 5 to 10 millimeters of mercury, but together, the effect could be much greater. Communication is key. Always inform every healthcare provider about all medications you're taking, including over-the-counter drugs, supplements, and herbs, occasional use medications, recently discontinued medications. Monitoring strategies. If you're taking any of these medications regularly, check blood pressure at home regularly, know your resting heart rate and watch for changes, report new symptoms immediately, chest pain, palpitations, shortness of breath, swelling. Don't ignore subtle changes like decreased exercise tolerance. The benefit-risk calculation. Remember, these medications exist because they provide important benefits. The key is ensuring benefits outweigh risks for your specific situation. This requires honest conversations with your healthcare providers about your complete health picture. We've covered a lot of ground today, from common pain relievers to life-saving cancer treatments. The goal isn't to create fear but to empower you with knowledge. Remember these key takeaways. First, no medication is completely without risk, but understanding these risks helps you make informed decisions with your healthcare team. Second, never stop prescribed medications without medical supervision. Abrupt discontinuation can be dangerous. Third, seemingly harmless over-the-counter medications can have serious cardiovascular effects, especially when combined or used long-term. Fourth, your pharmacist is an underutilized resource. They can identify potentially dangerous drug interactions and suggest safer alternatives. Fifth, lifestyle modifications, diet, exercise, stress management, remain the cornerstone of heart health and can sometimes reduce the need for medications altogether. Knowledge is power, but it's meant to be used wisely. Use this information to have better conversations with your healthcare providers, not to self-diagnose or make unilateral treatment decisions. Your heart beats about 100,000 times a day, pumping life through your body. By understanding how medications affect this vital organ, you're taking an important step in protecting your cardiovascular health for years to come. Stay informed, stay engaged with your healthcare, and most importantly, stay heart healthy.